Hi students, myself Dr. Marciano John Vialipol, Assistant Professor from the Departments of Prosthodontics, Crown Bridge, Vinayakamshin Sankaracharya Dental College, Salem. Today we are going to talk about the topic major connectors in the removable partial denture. What are the components of removable partial denture? There are connectors, retainers, rest and denture base. In connectors we have major and minor connector. In retainers we have direct and indirect retainers. Today we will be talking about the major connectors. The major connector connects the parts of processes located on the one side of the arch with those on the opposite side. All other parts of the partial denture are attached to it either directly or indirectly. The requirements of the major connector: it must be rigid, provide vertical support and protect the soft tissues, provide a means of obtaining direct retention where indicated, provide an opportunity to positioning the denture base where needed, maintain the patient comfort. What are the types of maxillary major connector? Single posterior palatal bar, palatal strap, anteroposterior or double palatal bar, horseshoe or U-shaped connector, closed horseshoe or anteroposterior palatal strap, a complete palate. Single posterior palatal bar is narrow, half oval with its thickest part at the center. The bar is gently curved and should not form a sharp angle at the juncture with the denture base. Advantages of only indicated in interim partial denture. Disadvantages is one of the most difficult major connectors for the patient to adjust because it maintains a degree of rigidity. It has to be bulky. It should never be used in a distal extension edentulous situation, nor should it be used in anterior regions where replacement is required. Next we will look into the palatal strap. Wide thin band cross sections crosses the palate, should not be less than 8 mm width or its rigidity may be compromised. Used for a unilateral distal extension situations but rarely used in a bilateral situation. The advantages are located in 3 planes. It offers greater resistance to bending and twisting forces. Greater rigidity with less bulk of the metal is provided. Thin, increased patient comfort. It offers little interaction of the tongue and is thus accepted well. Disadvantages is that the patient may complain of excessive palatal coverage. The anterior border should be posterior to the rugae area. If this is not possible, the border should be terminated in the valley of the rugae. The posterior border should be terminated short of the junction of the hard and soft palate and must avoid crossing a torus or a prominent medial suture. Another possible disadvantage is that adverse soft tissue reaction is in the form of papillary hyperplasia. This condition is seen when the partial denture is worn 24 hours a day and is normally accomplished by poor or oral hygiene and poor care of the processes. Next we will look into the anteroposterior or double palatal strap. This connector should not be used unless the remaining teeth are good periodontally supported. The advantages are: main advantages is it rigidity. May be used when support is not major consideration and when the anterior and posterior abutment are widely separated. In patients with large palatal torus for whom surgery has been ruled out. Disadvantages of this is, as a general rule, the anteroposterior palatal bar should not be considered as the first choice of maxillary major connector. Because of its limited palatal tissue, the little support is derived from the bony region. It is also frequently uncomfortable. Next we look into the horseshoe or U-shaped maxillary major connector. Thin band of metal runs along the lingual surface of the posterior teeth and extending onto the palatal tissue of up to 6 to 8 mm. Anteriorly covers the cingulum and extends onto the palate covering the entire rugae region. The borders must either be 6 mm from the gingival margin or extend onto the lingual surface of the teeth. The advantages are: this connector is used primarily when several anterior teeth are being replaced. This reasonable, strong connector that can derive some vertical support and some indirect retention from the palate. Disadvantages that when vertical force is applied to it either or both ends, there is a tendency for the connector to spread or straighten. Therefore, it is poor choice of a distal extension partial denture. For the same reason, it is not good connector when cross arch stability is required. It is less resistant or to flexing and movement can occur on the distal end of the connectors. Closed horseshoe or anteroposterior palatal strap. Structurally strong and rigid. They may be used in most maxillary partial denture design and is particularly indicated when numerous teeth are to be replaced when a torus is present. The thickness should be uniform and the borders should be 6 mm from the gingival margin or extending onto the lingual surface of the teeth. The advantages are the closed horseshoe is a rigid connector that delivers a good support from the palate even through an opening is provided in the palate. The shape of this connector also provides a definite L-beam effect, that is metal lying in two faces increases the resistance of flexing. Disadvantages are interferes with phonetics may occur in some patients. In addition, the extensive length of border for the tongue to contact may occur annoyingness or discomfort to the patient. Now we look into the complete palatal major connector, provided the ultimate rigidity and support to the denture. The posterior border extends to the junction of the hard and soft palate. The anterior border is 6 mm away from the marginal gingiva or must cover the cingulum of the anterior teeth. The advantages are complete palatal coverage is indicated when the patient posterior teeth are to be replaced bilaterally. It is also indicated when anterior teeth requires replacement along the bilateral distal extension replacements. Disadvantages are because of extensive tissue coverage, adverse soft tissue reaction is a form of inflammation or hypertension may occur if adequate or oral hygiene is not practiced. Problems with phonetics may occasionally be encountered. Types of mandibular major connectors: lingual bar, lingual plate, double lingual bar or Kennedy bar or labial bar. Now we look into the lingual bar. This is the most frequently used mandibular major connector. The basic form of this is half pear shaped with broadest portion at the inferior border of the bar. At least 8 mm of the vertical space between the active tissue of the floor of the mouth and the gingival margin of the teeth is required. This permits major connector to have a minimal width or height of 5 mm and is essential space of 3 mm between the gingival margins and the superior border of the bar. The advantages are because of its simplicity in design and construction, the lingual bar should always be used unless one of the other connectors offers a definitive advantage. It is indicated for all tooth supported removable partial denture unless there is insufficient space lingual to the remaining teeth. The lingual bar has minimal contact with the oral tissue. It does not contact the teeth, so decalcification of the teeth surface because of food or plaque collecting around the major connector does not occur. The disadvantages of the lingual bar are they are rigid and care must be taken by the laboratorian for proper instructions to be given by the physician. The resultant bar is almost inevitably too thin and therefore flexible. The lingual plate. A pear-shaped lingual bar with a thin solid piece of metal extending upward from the superior border of the bar onto the lingual surface of the teeth. The free gingival margin and the sulcus must be relieved. The superior border of the palate must be contoured to intimately contact the lingual surface of the teeth above the cingulum and to completely close off the space between the cingulum and the contact points of the teeth. Sealing of the embrasure from the lingual aspect prevent the food from being accumulated into the region. The advantages are it is indicated when posterior teeth have been lost and there is a need for additional indirect retention with the anterior teeth. The disadvantages are for the patient frequently feel more annoyingness and entrapment of gross portion of the food debris across from the marked crowding of the mandibular anterior teeth are frequently exist. The double lingual bar or Kennedy bar. This differs from the lingual plate in that no sheet of metal is present. The two bars are joined by rigid minor connector at each end of the upper bar. The minor connector should be located in the interproximal spaces. The advantages of the double bar are effectively extend to the indirect retention in the anterior direction provided it is supported by the adequate rest at each end. It also contributes to horizontal stabilization of the prosthesis because stress on the partial denture is distributed to all the teeth in contact. Thus, the total stress on each teeth is reduced. Therefore, it is indicated primarily when some degree of indirect retention is required and when periodontal disease and is treatment has resulted in large interproximal embrasures. Disadvantages. The patient frequently feels more annoyance in the tongue. Entrapment of food debris due to the marked crowding that mandibular anterior teeth are frequently exhibited. Now we'll look into the labial bar. This runs along the mucosal labia to the mandibular anterior teeth, or in some instances facial to the posterior teeth. It has half pair similar to the lingual bar. The advantages are when the lower anterior teeth and the premolars are so severely lingually inclined. The disadvantages are the result of the labial bar are generally poor. Bulk of the contour distorts the lower lip. The presence of metal between the gingival tissue and the lip causes patient discomfort. Thank you for watching the class.